Okay, awesome. Welcome. Welcome to our MD/MPH information session. We will have some slides as part of our presentation, and you'll hear from all of the program leadership. And then we have a couple of students here who are current MD/MPH students with us to talk a little bit more about why they joined the program, what they're getting out of it thus far, and how they navigate doing two different systems. And so we'll go ahead and get started with an overview. So we'll meet the team that is the leadership team on both sides of the program. So those of us from the School of Medicine and those from the School of Public Health. We'll talk a little bit about timeline. How does this program look as far as when do you start? When do you take courses in the School of Medicine, and when do you take courses in the School of Public Health? We'll go a little bit into what the MPH curriculum itself looks like. What kinds of classes will you be taking? Are they online, in person? We'll be doing some program highlights of those things that we do outside of the curriculum. So there's lots of curriculum things that you'll be doing with courses, but then we also supplement with a lot of non-curricular events that we have. We'll hear from our two students here with us today, and then we'll open it up to some question and answer. So I'm going to go ahead and get started with the meet the team and the School of Medicine side. Dr. Taylor.
Hi, so I guess good afternoon. It depends on where you're calling in from, everyone. It's great to have you all with us today. My name is Barbara Taylor. I am the Assistant Dean for the MD/MPH program here at the Long School of Medicine. I'm also a professor of infectious diseases.
And my name is Stephanie Gutierrez. I am the manager for all of our dual degree programs here at the Long School of Medicine, MD/MPH being one of them. So happy to meet you all, and we'll turn it over to our counterparts at the School of Public Health, Dr. Patel.
Hello, everybody. It's great to be here. I'm Premal Patel, the MD/MPH Program Director on the brand new UT School of Public Health San Antonio side. And I'm really happy to be here, happy to see all this interest. The other hats that I wear, I'm also a professor in the Department of Medicine and also get to work with Dr. Taylor in multiple ways. So I love that. Glad to see everybody here.
Hi, I'm Michael Halpern. I'm the chair of the Department of Health Policy and Health Services Administration in the School of Public Health. I am a MD/MPH, and that's been very important in my career. And I'm also a member of the Population Science Prevention Program at the Mays Cancer Center.
And Celinda.
Hello, everyone. I'm Celinda Cortas. I'm the programs coordinator for the School of Public Health side. Here to answer any questions you might have in regards to admissions, all that good stuff. But thank you guys so much for coming.
Thank you all. So we're going to turn it over to Dr. Taylor to tell us a little bit about the program vision.
We are very excited to be partnering with our new School of Public Health, but just to let y'all know, our program has been running for quite some time, since 2007. And our main goal is to prepare physician leaders like yourselves with skills and knowledge to improve the health of their communities through direct patient care. That's what your MD will do, and it will do incredibly well, but also through skills that the MPH will give you, like advocacy, research, and how to improve health systems. So actually, our tagline, Advocates, Educators, Researchers, Doctors, was developed by an MD/MPH student. We had a competition, and this one won, was voted by our MD/MPH students. And I do think it really encapsulates what we do in the MD/MPH program is we focus on the whole you, not just your MD side or your MPH side, but we want you to become the best version of yourself that exists at the intersection of medicine and public health. What that looks like for everyone differs, but that's our goal for you all.
So now we're going to take a little bit of a look into the timeline of when you start the program, when you'll be taking courses in each part of the program, and then when you would be graduating. So starting this summer, and so that's actually this coming summer, starting in May 2025, you would start in classes with the School of Public Health. These courses would be online because we know that most of you will not have been moved to San Antonio yet because the School of Medicine doesn't start until July. And that's when you're expected to be here in person. We do have these courses online for you to be able to still complete them from wherever you're at. You then will start the MD program. And at that portion, we take a pause on the School of Public Health because we really, with the experience of the program that we've been running, really understand that that semester is really large learning curve for you guys as far as material, content, but also how to be medical students, how to be professional students. And within that, you also have your modules within the MD. You also have anatomy, clinical skills. And so there is quite a bit to do on the MD side. So we don't want to overwhelm everyone and really put a pause. And I think all of our students have really appreciated that pause, to really let them integrate themselves within professional school and to really understand what it means to be a professional student. After that semester, you'll rejoin both parts of the program. So in the spring semester of your MS1 year, you'll be taking courses within the MD program and the School of Public Health. Those two courses will be in person because you'll be here in person for the MD side. So we do expect that you'll be in person for the MPH courses as well. There is one course in the summer, kind of small summer, that you get on the MD side, which is either 4 or 5 weeks, depending on how the calendar falls. But during that time, you'll be doing an MPH course. And then in the fall of your MS2 year, you'll be doing courses within both programs as well, both in person again. After that, you'll then go into a pathway in the med school, which is different for everybody. Everybody takes step at a different time. Everybody starts clerkships at a different time. And because of this, we didn't want you to also feel the pressure of doing courses within the School of Public Health or trying to figure out how you could do that while starting clerkships, clinical rotations. And so we do put a pause on the School of Public Health part of the program again to give you that space to step study, to start early clerkship rotations if you wish, maybe do some research, maybe do a global health trip. That's kind of up to all of our students individually how they want this pathway to go. And then also throughout your clinical rotations, we also put a pause on the MPH because we know clinical rotations differ from each one to each one. You may have night rotations. You may just be very overwhelmed with the experience itself. And so we do want to make sure that you're putting your attention towards that and have that intention behind your clinical rotations. But when you come back for your 4th year, you'll rejoin both parts of the program again. And so you'll do 2 courses in the fall of your MS4 year that will be online. And then you'll have a course there to finish in the spring of your MS4 year. And then you'll be able to graduate with both degrees within the 4-year time frame. This is a very prescribed program, so any deviation could put you off of the timeline of 4 years. We wanted to make sure that we still held the 4-year component because we feel like that's a really important part for our students. And so we really map this out. But, there is some flexibility if something comes up where you have something happen in your life and just need to take a pause, we will definitely work with you. But for the most part, this is how the courses are laid out, and this is how your progression through both sides of the program will exist. I'm going to then pass it on to Dr. Patel to tell you a little bit how to apply.
Thank you, Stephanie. I'm going to walk you through this application process. It might look a little daunting, but with everything that you've already done, this is going to be a piece of cake. Just want to make sure it's as clear and stress-free as possible. As we go through this, Alinda, do you think you could drop the how to apply materials in the chat and our checklist? And if you can't download it or you're someplace where you can't get it, don't worry, we will email this out to you as well. So this is our kind of step-by-step how to apply. You're going to start your application through the AHCAS, we call it ACAS system. They will ask for a GRE, but instead use your MCAT score. And the required materials that you're going to need to upload are going to be your TMDSAS application. We're asking that you just upload it as a PDF so that you don't have to re-enter a lot of duplicative information that's already in that application. We're going to need transcripts from all the schools you've attended and 2 letters of recommendation. And just keep in mind that these letter writers should specifically highlight your interest in public health. Your personal statement, this is your chance to tell us why public health matters to you, how it kind of fits into your personal and professional journey, and a supplemental essay. So this is a place to expand on your passion for public health and really strengthen that application. A few important notes is there is no application fee. That means there's nothing that stops you from applying, and you're not going to need to submit all of the materials just through ACAS. Once you submit the materials that we've already asked for, go ahead and email us at cssa.utHSCA, CSSA.edu. To confirm your application is complete, I believe the email on there is accurate. And our hard deadline is March 31st. So mark your calendars, make sure that you can apply early. If you run into any issues, please feel free to email us. We're happy to assist you. And then next slide, I'll go through some of the MPH form of the curriculum. This isn't just another set of courses, but it's a fundamental paradigm shift in how you're going to be thinking about healthcare, and we really want to equip you with the skills to make a meaningful difference. As we said, this is a brand new program, but it is very unique in that we've designed the MD-MPH concentration, the health systems and the community context with you in mind. We collaborated with current MD-MPH students, with faculty, public health leaders to really be intentional about creating a program that is at that nexus of public health and healthcare. And our mission is to educate, inspire, and empower future physicians to actively pursue careers and leadership roles in public health, driving meaningful change and advancing the health of communities. Curriculum breakdown is you have a core set of public health courses. These are the foundational knowledge and foundational competency areas. These are kind of the essential building blocks of public health. They include things like epidemiology and biostatistics, health promotion and health behaviors, so really understanding the drivers of our health behaviors, health policy and advocacy, so learning how to influence and shape policy at national and international levels, environmental health and occupational health as well. There is a hands-on experience with applied practice experience where you have the opportunity to work in real-world public health settings and apply the skills that you've learned. And the integrative learning experience. This is a course or paper that really helps you synthesize the public health kind of domains and competencies you've learned. We have concentration specific courses. They're the three listed here. Health systems leadership. So how do you develop the skills to lead in public health and healthcare settings? Some of these skills are very overlapping with just clinician leadership, but are more expansive than that as well. Public health data and systems. So being able to utilize evidence-based decision making. And health systems in the community context. So understanding how health systems function at the community level and what the levers of change are that you can invoke in that space. So again, this curriculum is designed to ensure that you not only graduate as a fantastic doctor with your long school of medicine curriculum, but as a physician who really understands how to create systemic change and improve health beyond the individual patient. Next slide, please. We do get a lot of frequently asked questions from applicants. So these are the ones that we hear most of that we wanted to discuss. Again, if there are any other questions too, please feel free to let us know. There is a separate tuition for the MPH, and this is because the MPH is being offered through the UT School of Public Health San Antonio. It is separate tuition, but don't worry, when you're enrolled in both programs at the same time, you're really just going to get one bill that includes both the MD and the MPH side of the tuition. The MPH is 45 credits, and because this is a dual degree program, up to about 12 credit hours can transfer from your long school of medicine MD coursework towards credit for the MPH. So this means you need about 33 additional MPH credits to complete your degree. Cost-wise, this means that the entire 4-year MPH is about 11 to 13,000 for in-state students, and this is significantly lower than kind of our standard MPH tuition, which is about 18,000. This is not inclusive of school fees, so that's going to be an additional cost. In terms of modality, many of our courses are online, in person, or hybrid, really depending on where you are in the MD curriculum. So as Stephanie pointed out before, the start of medical school, we have online kind of more flexible courses. And mainly this is for you to be able to knock out a couple of these core foundational courses before you even start medical school. And it really lightens the load when you start. Spring of your first year is going to be in person. Again, this summer, between your first and second year, you're going to have online courses. And we do have in-person courses for the fall of the second year. We want to make sure that for some of those more challenging courses, especially quantitative, qualitative evaluation, that you have in-person kind of face-to-face time with faculty. And then during your third year, you kind of are able to focus completely on the MD degree, and you come back to us during your fourth year where we'll have hybrid courses. So I'm going to hand it back over to Stephanie, and also happy to take any questions if you have any as well.
All right, so that was a lot about what the actual curriculum, what you'll be learning in the courses. So now we'll be talking a little bit about all of the supplemental things we do to really help you with the intersection of medicine and public health, how those come together for you individually on your progression throughout medicine, what you're wanting to look into for a future career, and even just introducing pathways that are possible to you for being an MD MPHer. So we're going to start with professional identity formation, and I'm going to turn it over to Dr. Taylor.
Thanks so much, Stephanie. So to highlight something about the program, so Stephanie and I, and really everyone on this call at this point, works with many other dual degree programs. We have launched a consortium across the nation, and we can say with confidence that we are one of the MD MPH programs that has the best and most robust support structure for our students than really any other program in the nation. So one of the things that I think is unique about our program is that we really focus on professional identity formation. I mentioned at the beginning that our vision is that you are fulfilled as a whole human being, not just as a medical student or as a public health student. And our goal is really to help you identify the areas that you're passionate about and pursue your own professional identity, because it can vary a lot within a public health career. So one of the first things we do is we have an MD MPH elective, which we just had our final session of yesterday. And Mega and Austin, who are on the call, were both there. And this is really focuses on the intersection between medicine and public health. And our goal is to introduce all of our incoming students to different career pathways in public health through both sort of didactics, but also through examples. So we invite people like the chief medical officer of our county hospital, who is an MD MPH, to come and talk to us. Yesterday, the director of the San Antonio Health Department came and spoke to our students about careers in public health and opportunities for them actually within the health department and the work that our health department does. So we focus on like potential career pathways include things like hospital leadership, city health department, health disparities, or other types of population health research, and city programming and public health. We supplement this with individual advising and mentorship meetings. So Stephanie and I have one-on-one meetings with every student in the program twice in the first year and once in every subsequent year. This on the School of Medicine side, we use this to talk about where you are as far as your own individual professional identity formation and how for you, what is the intersection of medicine and public health, and what are your areas of interest? We use these sessions to sort of help you reflect on those things and also to connect you and link you to people who are doing work that aligns with your interest in the community and globally. The School of Public Health side, Dr. Patel will talk a little bit more about that, but you'll meet with the faculty advisors at the School of Public Health to discuss completion of your MPH, how you can use the courses and the knowledge that you're gaining and your practicum and your experiences to really flesh out your own skill set and what you're interested in doing within the intersection of medicine and public health. I'll pass it back to Stephanie.
All right. Along with that, we also provide a lot of mentorship and at different levels. So we first have our peers mentorship program, and that is where you'll have peers who mentor you. So you'll have next year 3 second-year medical students who will become second years. They're currently first years still. And then you'll have 3 fourth-year mentors. And those mentors are really great because they're in the program. They're going through it at the same time as you. of course, they're in a little bit of a different program because they're with our previous partners in Houston and you're with San Antonio. But the overall sense of the program is the same. The curriculums are just a little bit different, but we'll still be able to talk about how you navigate doing two different programs, how you're really navigating your professional identity and really understanding amongst your peers in the School of Medicine that you have these additional skills that some of your peers don't, how you really come across that in when you meet preceptors, when you are in the clinical environment, how all of those things come together. We're still be able to talk about all of those things. We also have faculty mentors. So we have Dr. Barbara Robles Ramamurthy, who is a psychiatrist, and Dr. John Byrne, who is an OB-GYN physician. And both of them are faculty mentors for our students who are specifically interested in those things, but just overall with who are just interested in talking to people who are in medicine and doing public health. They are wonderful mentors for our students. But then we have a lot of just faculty mentors on the School of Medicine side who have MD and PHs who are, of course, resources for our students. And then we have, of course, all of the leadership team here who also provides a lot of mentorship for our students because we really feel like to be able to navigate two programs, we really need to support our students in an extra way to help them not only get through the programs, but also really find meaning behind what these letters behind their name are going to mean and what they mean to them specifically. In addition to that, we also do a lot of community building. So not just with the community here on the call, but community of the cohort. So the first year cohort, we make sure that they all know each other and can lean on each other for courses, can lean on each other in times when it's really difficult or when it's really exciting and we can really celebrate with each other, but really just a community of MD and PHers. So we make sure there are times where we get all of the cohorts together. We do that through a number of different ways. We have an orientation where if you are apply to the program and then get into the program, we will have an orientation with you with people on this call, but we'll also invite all of our current students to come meet you as well, just to kind of celebrate you into the program and really start to get to know you a little bit better. We have class specific dinners. So each class will have a dinner. The first year students are having theirs in April. And then in the fall, we have the second, third, and fourth years. And it really gives time for those classes to see each other because sometimes they're in different spaces and so they don't get together, but also talk about what they're going through at that specific time. So for example, our fourth year students, we have a speaker who talks about preparing for residency interviews and preparing for the questions that they'll be asked, but also how do you organize yourself? What are different ways that you can track where you're going, what are your thoughts? But also then when you're transitioning into residency, what are things to think about, such as you need to get malpractice insurance. Do you or do you not? Does your program give it to you or is that something that you have to get on your own? What kind of insurance should you be looking for if you're interested in having a family? What are the things that you should be thinking about when it comes to that big transition? We also do preparatory sessions depending on where you're at in the journey of medical school. So for our second years who are about to become third years, we did a session with them in January on going into the clinical environment. And we had a third year student, and we usually have a couple of third year students who are in the environment at the moment, and they can come back and say, here's how I prepped for my first day of clerkships. Here's how when an attending tells me they want me to report back on a specific subject, here's how I look for information. Here's, tips and tricks of how to give that presentation back to attending. So what are they looking for? Just to really help them ease into that environment and feel confident and comfortable going into that. And we do that on different kind of topic areas. We have an annual dinner, which is coming up for us now, where we really bring together everyone just to really celebrate the year, celebrate our graduating students, and really just have a good time together. And then we usually do a day of service where we give back to our community. So you can see this picture was last year's day of service where we went to the food bank and did a day of packing dinners that were given to our elderly population in San Antonio, and just really give back to a community that gives a lot to our students by allowing them to work with community partners. We want to make sure to support those partners and lift them up as well. And for alumni engagement, I'm going to turn it back to Dr. Taylor.
So in some ways, I feel like Stephanie deserves a lot of credit for this because she is outstanding at engaging with our alumni. So I get to present about our amazing alumni, but there are really a lot of the kudos go to Stephanie. So one of the questions that many of our students ask us is, so what do people do with their MD and PH in the future? And we're fortunate to really have a lot of engaged alumni who are happy to provide both advice in groups and also one-on-one support for our students in terms of what is it actually that they do with their MD and PH post-graduation. So our alums help us with mock interviews. It is very important for us as a program to make sure that you are ready for residency interviews and applications, and that you can showcase and highlight the additional skills that your MPH brings you as you move into the residency application process. So we do mock interviews. Our alumni help our students practice answering questions about the MPH and how you might use it in your residency and career. We also have an active alumni council who are from various specialties, work across the country and also some globally to provide mentorship for our students. We have alumni chats where these are virtual sort of Zoom sessions, kind of like this, where alumni come in from all over the country to focus on different careers and specialties. An example recently was we have an alumna who runs sort of child health for the entire state of Tennessee. She works for the Tennessee State Department of Health. And so she talked about her work, and she was paired actually with an alumnus who works in psychiatry and has founded her own practice in integrated psychiatry. So two very different ways of engaging in public health and medicine, but lots of insights for our students. And then we have, as Stephanie mentioned, specific specialty and program mentors who can talk about specific, like if you are going into surgery and have an MD and PH, we have alumni who are happy to talk to you about how their MPH is useful in their careers as a surgeon, for example. And I will pass it back to Stephanie.
All right. Do you hear sound happening? No? Okay, that's just me. Somehow sound started playing. So I'm gonna leave this slide up because some reason there's sound playing in my ear when I go to the next slide. We are now gonna hear from our students. And so we have two wonderful first years here with us. So we have Austin and Mega, who are in the first year MD and PH cohort. And I'm going to ask them just a few questions so that they can talk to you a little bit more about their experience. So our first question is going to be why you joined the program. And so either Mega or Austin, whichever one wants to go first, just kind of introduce yourself and talk a little bit about why you joined the program.
I can go first. Hello, my name is Mega. I'm a first year medical student and I'm in the MD MPH program. I decided to apply for the MD MPH program because in college I took a minor in business and healthcare, and I learned a little bit about public health and global health. And I learned to see health from a perspective that I couldn't see from volunteering in the hospital or the clinic. And when I finished my minor and focused on taking science classes for my major, I realized that I missed being challenged to see healthcare holistically and to see how I can not only impact individual patients, but impact the health of entire communities. So I was really excited when I learned about the opportunity to pursue both an MD and MPH program. So I decided to apply.
Hi guys, I'm Austin. I'm from Utah. I decided to join the MD-MPH program because I think in my undergrad and my extracurricular experiences, such as volunteering and doing clinical work, I saw, I guess, some of the disparities and bigger scale issues that were going on in my community, and I had implemented that in my application and really thought a lot about it. I didn't really know what to do with it until we had an information session on the MD-MPH and kind of introduced this idea of public health to me. So it's totally okay if this is like the first time you're really hearing about public health, because that is not an uncommon experience. But yeah, after doing that, it kind of sparked this idea to join that kind of program.
Yeah. I know both of you are still pretty early on in your time in the program, but what have you gotten out of the program thus far? Whether it could be experiences you had, or maybe just the community or mentorship that we have throughout the program.
I think we had mentioned that you'll be taking classes the summer before you start medical school. And I remember the first few classes I took, I really loved it. And I was just thinking, wow, this is what I wanted to learn when I decided to join the program. Um, but when I came to campus to start medical school, I felt so supported and welcomed by the MD MPH program, by all of our faculty, mentors, and also the current students that are in the program. Um, because I feel like our class is pretty big, 240 students, but you know that there are people in your program which is a smaller size, that they are so willing to help you navigate not only the dual degree program, but also your MD classes and just anything. So,
I think what I have enjoyed the most is going back to what Stephanie and Dr. Taylor were talking earlier about the professional identity development. I feel like I have been able to meet with people and also in my classes and just other meetings that are related to the MPH program. I've been able to like elevate my goals for my career to beyond just being a clinical physician. And I don't think that makes me a better physician or anything. It's just like kind of what piques my interest more. Um, but I think that that broader perspective has shaped like how I think about my future and like the type of role I want to play in my communities and in my family and where I want to go. And for me, that has been just that network of opportunities and people that are able to guide me in that has been super awesome.
All right, last question. One of the questions we get asked the most, and which is why we're asking you, is how you navigate both programs together, how you keep yourself organized. Are there things that you've learned along the way? Are there tips that you can give to students who are interested in applying or maybe think that it's a little bit daunting?
Something I really appreciate about the program is your first semester of medical school, you don't need to take MPH classes. And that first semester can be really rough, especially if you are taking a gap year. Um, but that semester you can just focus on your MD classes and focus on that transition into taking such difficult classes. Um, so by the time second semester comes around, you're more familiar with your MD classes, and the course load is also lighter. And that's when you'll start taking MPH classes on top of your MD classes. And what I found has helped me in taking both classes at the same time is making a schedule of all the due dates for your MPH classes. Usually you have weekly deadlines. So if you're keeping on top of your assignments, it's very manageable.
This is something that I was really concerned about going into the MPH program. I'm married and I have a kid, and so like something that was important to me is I would be able to spend time with my spouse and kid. So um, I think kind of started with just a leap of faith. But so I guess with all that, I just want to say like you can dispel your fears, I guess, in some ways. You I think you just learn to adapt to it, and you learn to manage your time better, and it's a skill that you learn. And I think especially like Megan was saying, with having like that first semester with just the medical school aspect, it helps you to just ease into that transition. Yeah, I think just again reiterating planning your time. I think also is having the extra load has helped me to really distill what my priorities are. I've been able to like understand like if there's certain things I want to participate in, like where does it fall? Because I don't have all the time in the world. And I think actually it has helped me be a better student on the medical side as well. I've always been able to do really well in my classes and in both aspects. And so I feel like it's just made me a stronger and more professional student. So
Thank you, both Mega and Austin, and they'll be with us still. So if you have questions when we open it up for question and answer, you feel free to ask them more questions. All right. So next we have our student leadership. We did feel like this was an important part to add to our program because we wanted to make sure students were building leadership skills. And what better way to do that than to give them roles to fill to be able to practice those skills. So one of our options that we have is the student representative, which Mega will be this coming year. She'll be taking over this role. And this is a pretty easy role. It's a one-term year, usually during your MS2 year. And you really help promote the events that we have, make sure that the cohorts have any information that we send out to make sure that those things are spread throughout the cohorts, beyond the emails that we send. It's pretty easy, not a lot. You'll work closely with us and just get to know us a little bit better. We also have our peer mentors, which we always love to have, and I think is a really rewarding experience both for the students that are getting mentored, but also for them as mentors. They get a lot out of it as well. And so you can do this as a second year or fourth year, or you could do both. We have, this year was the first year where we had some of our fourth years were previous peers mentors as second years. And so it really for them came full circle to be able to give that mentorship in two different years and have two different levels of experience in the program to be able to offer to our incoming students. And they really felt like that was one of the most meaningful things that they did. This year we'll have 3 second year and 3 fourth year, which is usually what we have. And so that's a thing that you can sign up to be when you're transitioning into your second year. I will turn it over to Dr. Taylor to talk about our match results from last year.
So this picture makes me laugh every time. So this is Monica, our graduate, who is one of the people who matched successfully, as you can tell, into surgery. And she got where she wanted to be. And she remains a sort of mentor and advisor for our students who are interested in surgical subspecialties. But I think one of the reasons that we wanted to highlight the match results is because there sometimes is a perception that if you are going to do an MD and PH, then you need to be doing something in primary care. And as you can see, our graduates really cover the gamut. They successfully match to subspecialties, like we had 2 match in anesthesiology. That's not, we don't always have 2 going into anesthesia, but we had 2 match in anesthesiology last year, emergency med, but also, people deeply committed to psychiatry, to pediatrics. Usually this year, there's some IM folks, some family medicine folks. So really, I hope that we can impress on our students, but also on our applicants that the public health is relevant to anything you want to pursue in medicine. And our job as a program, as a collective program, is to help you figure out what you're really interested in, passionate about, and how to pursue that in the intersection of medicine and public health in that. So we're really proud, as you can probably tell, of our students and our alums, because they do go out and do so many different things to advance the public health of the health of their communities.